Hello, good noon. I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name, please? Nice to meet you, Mr. Sam. May I know what brings you here today? Mm-hmm. Okay. Mm-hmm. Tell me more. I'm very sorry to hear about that incident, Mr. Sam, and I totally understand that how a stressful situation would be for you. But Mr. Sam, let me explain that there is difference between HIV and AIDS. Okay, HIV is human immunodeficiency virus. Okay, and AIDS is acquired immunodeficiency syndrome. Okay, and remember the difference between both diseases. Okay, and screening for HIV only tells that you have been exposed to this virus. Okay, you may never develop full-blown AIDS because of and your prophylactic treatments. Okay, and let me reassure you that HIV infection may take 10 to 20 years to convert into AIDS, if it makes sense to you, Mr. Sam. Mm-hmm. All right, Mr. Sam, if there is anything else you would like to add. Mm-hmm. Yes, Mr. Sam. So, in order to better understand, may I ask you a few personal questions? And if you don't mind, and Mr. Sam, but let me reassure you that the discussion will remain confidential between you and me. Okay. Mm-hmm. Thanks for trusting me, Mr. Sam. So, if you are married, do you have any children? Mm-hmm. Okay. And have you got any extramarital relations? Mm-hmm. Okay. Right, Mr. Sam, did you had any blood transfusion recently without testing for HIV virus? Mm-hmm. Do you share needles for IV drug abuse? Mm-hmm. Do you remember any accidental needle stick injury? Mm-hmm. Any a barber shop blade injury? If you ask them to use new blade. Mm-hmm. All right, Mr. Sam, so as you had accidental exposure by needle stick injury, okay, and but let me reassure you that the risk of HIV infection is 1 in 300, okay, and risk is 1 in 3,000 if blood is splashed over skin or in eye or mouth, okay, and exposure is significant if a source is HIV positive and material is blood or any body fluid, if it makes sense to you, Mr. Sam. Mm-hmm. All right, Mr. Sam. So, what you did immediately after needle injury? Mm-hmm. If you allowed a wound to bleed freely to flush out virus. Mm-hmm. If you washed affected area with soap and water. If you applied any aseptic solution to wound. Mm-hmm. All right, Mr. Sam, you did great. Okay, and besides that, I'll suggest you some blood sample. Okay, for HIV. Okay, and hepatitis B and C and syphilis serology. Okay, is it convenient for you? Mm-hmm. Yes, Mr. Sam, and besides that. I'll refer to a clinic for start a heart treatment within 1 hour. Okay, if it makes sense to you. Mm-hmm. Yes, Mr. Assam. Remember, testing for HIV is entirely voluntarily. I will need an informed written consent before testing. Okay, and you need to come back in person for collection of results. Okay. Mm-hmm. Yes, Mr. Sam. Do you need um, to know what are pros and cons of testing for HIV? Mm-hmm. All right. You need not to be worried, Mr. Sam. I'm here to explain everything to you. Okay. So let me tell you some disadvantages of testing for HIV. Okay. If test came positive, okay, you will need to cope with the validating a diagnosis, okay, and positive result may affect insurance and employment prospects, okay, and a test is now offered to all, um, pregnant women as well, okay, and written information about the pros and cons of test are also available, okay, and let me tell you advantages for testing are, anxiety due to uncertainty about HIV status is ended, okay, and effective therapy is available which improve the prognosis, and knowing the result means that a partner can be protected and it can make a decision to move to safer sex, okay, and decision about pregnancy can be made, okay, if it makes sense to you, Mr. Sam. Yes, Mr. Sam, as you have needle injury, stick injury, I offer you a HIV screening test, and HIV antibodies can take 3 months to develop after HIV infection exposure, okay, so test may be negative, okay, and if it is negative, we will repeat the test in 3 months time. Is it convenient for you? Yes, Mr. Sam, as you are lab technician, I will recommend a post-exposure prophylaxis, which is combination of 3 drugs. Okay, and it should be initiated as soon as possible, ideally within 1 hour of exposure. Okay, and is continued for 28 days. Okay, and for that, I will refer you to a specialist. Okay. Mm-hmm. Is it okay with you, Mr. Sam? Mm-hmm. Yes, Mr. Sam, and I'll advise you to document and report needle injury to your supervisor as well. Is it convenient for you? Mm-hmm. Yes, Mr. Sam. After studying this medicine, I'll advise you to adherence to therapy, okay, as it is essential to avoid resistance. Okay, the aim is to decrease viral load to an undetectable level in less than 6 months. Okay, and response to treatment is met with viral load. Okay. And besides that, treatment failure requires switching or increased therapy, okay? And do not disturb, change dose, or make any change without, taking a specialist advice, if it makes sense to you, Mr. Sam. Yes, Mr. Sam. And besides that, I'll encourage you to follow some non-pharmacological measures, okay? Is it convenient for you? Yes, Mr. Sam. So I'll advise you to always have safe sex and use condoms, okay? And limit yourselves to your wife, okay? And try to take a blood for HIV infection before transfusion. And do not share needles for IV injection of drugs, okay? And if you got any needle prick injury, immediately wash it with running water, okay? And yes, Mr. Sam, if you are HIV positive, then it is better to tell your wife, okay? Tell her into confidence and try to have her tested also. And she might have contracted HIV already from you, okay? And so if not, she can be protected by a practice of safe sex, okay? And don't eat uncooked meat or salads, and don't drink unboiled tap water to avoid certain infections, okay, and diarrhea. And besides that, I'll encourage you to avoid poor nutrition and any stress, because it can weaken your immune system, if it makes sense to you, Mr. Sam. Okay, Mr. Sam, if you develop any fever, fatigue, or any swelling or lymphadenopathy, okay, any rash or any ulcerations, okay, or any diarrhea, okay, so I'll advise you to seek immediate medical help, okay, if it makes sense to you. Yes, Mr. Sam, besides that, I'm offering you a second follow-up visit after 1 month, and I'll continue to take care of you, although I am referring you to a specialist AIDS clinic for treatment, okay, and they will give a combination of 3 antiretroviral drugs called hard therapy, okay, and adherence to therapy is essential to avoid resistance, as I mentioned before, okay, and do not worry about the stigma attached to HIV infection, Mr. Sam, okay. Community offer great support both for victim and carer also, okay. Is there anything else you wish to discuss with me today? Yes, Mr. Sam, you can contact me if you have any queries anytime. You can count me in your supporting group, okay? And I'll follow up your care once you've been to a specialist clinic, okay? And here is a leaflet. It includes all the information regarding your condition, okay? And thanks for your cooperation. Take care. Bye-bye.